All right, if you pay any attention to your blood pressure, you're going to want to listen up. The official rulebook for managing it has just been completely rewritten for 2025, and believe me, these changes are a big deal. So let's dive right in and break down what's new and, more importantly, what it all means for you. First, let's just get a sense of this scale we're talking about here. Look at this number. Almost half, 46.7% of all adults in the United States are walking around with high blood pressure right now. It is incredibly common. And here's why that number is so scary. High blood pressure is the #1 modifiable risk factor for some of the biggest health threats out there. We're talking heart disease, stroke, you name it. And the trickiest part? It usually has 0 symptoms. That's exactly why understanding these new rules is so important. Okay, so first things first, the biggest update is all about how we categorize blood pressure. The lines have literally been redrawn. Knowing which new box you fit into is now step 1 in this whole process. So here they are, the 4 new categories. Normal is still the gold standard, under 120/80. Then there's elevated, which is that 120 to 129 range. But here's the real game changer. That old pre-hypertension category, it's gone. Now, if your top number hits 130 or your bottom number hits 80, you are officially in stage 1 hypertension. That's a huge shift. And this is exactly why those new categories matter so much. This chart shows, plain as day, how your 10-year risk of having a heart attack or a stroke just climbs and climbs with each step up. Your numbers, right now, are basically a sneak peek into your future health. Okay, so if these numbers are that important, we absolutely have to get them right. And that brings us to the second major focus of the 2025 guidelines, a huge new emphasis on how we actually measure blood pressure in the first place. This is a big one. The guidelines are now telling us that a single reading at the doctor's office just isn't enough anymore. You know that white coat stress that makes your numbers jump? Well, they're now strongly recommending monitoring at home to get a truer, more complete picture of what your blood pressure looks like in the real world. And whether you're at home or in the clinic, these 5 steps are totally non-negotiable for getting an accurate reading. You gotta relax first. Use the right cuff size, that's key. Sit the right way with your back supported and feet flat. No talking during the measurement. And always take at least 2 readings and average them out. Skipping any of these can throw your numbers way off. Now, here's something that might surprise you. For all of us who love our smartwatches and other wearables, the guidelines have issued a direct warning. They're saying we should avoid using these cuffless devices for medical blood pressure readings, at least for now. They just haven't been proven to be reliable enough yet for making important health decisions. All right, so you figured out your category, you know how to measure correctly, so what now? What do you actually do? Well, the new guidelines lay out a really clear 2-part action plan for everyone. And this is the foundation. It's step 1 for absolutely everybody, no matter what your numbers are. Lifestyle is always the first line of defense. We're talking about eating a heart-healthy diet, cutting back on salt, moving your body, and finding ways to manage stress. This stuff is fundamental. Now, the second part of the action plan involves this brand new tool called the Prevent Risk Score. Basically, it's a calculator your doctor can use to figure out your personal 10-year risk for a heart attack or stroke. And this score is super important because it's what determines what happens next. And here's where it all comes together. The decision to start medication is now totally personalized based on that risk score. If you're considered higher risk, the recommendation is to start medication as soon as your blood pressure hits 130/80. But if you're lower risk, the plan is to really focus on those lifestyle changes for a few months first to see if you can bring the numbers down naturally. It's a much smarter, more tailored approach. So after all of that, all the new categories, the measurement rules, the action plans, it all really boils down to one single powerful number. If there's one thing you take away from all this, let it be this. This is it. This is the magic number. For most adults, the big overarching goal of any treatment is to get and keep your blood pressure below 130/80. That's the target. All the science and all the evidence shows that staying below this number dramatically lowers your risk of a heart attack or stroke. If you remember nothing else, remember this number. So I'll just leave you with this question. Now that you know the new rules and you know that powerful target number, what's one small thing, just one, that you can do today to start heading in the right direction?